I think the reasons for my nomination were around the leadership style I've developed, which is respectful, and the comments in the report or the testimonial that went with the nomination said that I developed sort of integrity and honesty, which gave me credibility with the people that I'm trying to help to get to where they need to be. My leadership journey started when I took up practice about 10 years ago in a local GP practice, and I became involved in respiratory commissioning for the PCT as it was then, and found that I liked those kind of system approaches and was doing that voluntarily at first, just as a commitment and a learning experience, and then through PBC, PEC member, PEC chair, and then ultimately as we were revising the sort of structures under the white paper, put myself forward for the interim sort of chair of our clinical commissioning group. So fairly progressive over the last 10 years, and hopefully that's given me the experience and networking and contacts to help, you know, maximise my advantage for Warrington, really. I'll put my success as a leader down to the fact that I am respectful of people, and I always view my role as trying to help other people find what they need to do to progress things. And as much as the reform of the NHS is about giving us as a CCG local empowerment to commission the NHS, I think my role as a chair is to enable all the local clinicians and the local population to have that empowerment through us. And I don't see it as ours to own, it's ours to give away, and make sure that the governance and the accountability and all those formal things which the public quite rightly want to see done properly are there, but do that by letting people in the local population and local clinicians, not just GPs, work out what's best for our local NHS within the resources that we've got. My achievements so far for the NHS, I would say are A, becoming a GP and working at being a good doctor, as good as I can be. I think that the latter part of my career is becoming more focused on systems and patients and how they experience the NHS. So one of my greatest achievements, I think, recently is pulling together a structure which I think embodies those values and will help patients in Warrington get the best experience they can of the NHS.
To be nominated for this award and recognised for what I've done within the NHS over the last 30 years is an absolute pleasure. I feel really honoured, and at such a time of change with the CCGs developing, it's great to get that recognition. I think the fact that as a leader in the NHS at such a time of change, to be recognised as somebody who's inspirational and can motivate and enthuse staff and to keep people's motivation up is just something that I think has been recognised as a skill that I generally have, and you know, again, it's who I am. I think the difference maybe from myself to other people is the fact that over this past 2 years we've gone through a significant change in the NHS, and I think why would my nomination stand out? Well, I'm an inspirational leader. I'm somebody who can take people with me, create the environment for relationships, and I'm so passionate about making sure that the patient's the focus of everything we do within healthcare. I started off 30 years ago as a student nurse and did my nursing, midwifery and health visiting training, and then perhaps quite arrogantly at 27 thought I could do management better. I'm still trying to do that, but wanted to be the best leader I could be and change things and influence, and I think, you know, after 30 years, all the skills and experiences that I've had and working with some fantastic people and some fantastic leaders who supported me, it's just all great to have this honour to be nominated and recognised for that. I think what I would put my success as a leader down to is all the components that make me the person that I am. I think I'm a very genuine person. I'm absolutely passionate and committed to the NHS and its values, and the fact that, you know, what we're about is delivering the best quality patient care that we can, and keeping that patient as my focus, even through my clinical experience and into my leadership and management experience. What it would mean to me to win this award, I can't really describe in words. You know, the fact that I've been shortlisted in itself is just an absolute delight. I'm overwhelmed by that, and if I was to win the award, it would just be the icing on the cake of 30 years of a fantastic career. I think what I do is provide inspiration, I motivate people, I establish relationships, I build rapport with people, I get people working together for a common purpose around that real focus, which is getting the best for patients.
Absolute honour to be nominated for an award. It was a wonderful surprise, as you know, especially coming from one of the team. I suppose with any young organisation, we've come through many challenges in the last 12 months, and I think as a team we're very proud of what we've achieved and how we've used the precious resource that we're in charge of, how we've made maximum use of that. So I'm hopeful as a leader I've played my part in that. We've in particular worked very hard on implementing a telehealth project, and there's been a lot of collaborative working with our community trust, our local trust, our community staff, and the engagement that we've got there, and how we've come through that as a team and implemented that and showing early successes already, we're very, very proud of. I'm hopeful that the way in which that we've encouraged and harnessed innovation at all levels within the team has stood out to the judges for our nomination. I'm hopeful moving forward in the leader that I'm viewed as trusted and fair by the people I work with, and I try to have a perspective that when we're in difficult situations we try and look forward for that positive. So I'm hopeful that's what the team would feel. I'm grateful for my team in the nomination to mention me as a role model, and hopefully they know my passion for eradicating health inequalities, and I hope that stands out in the work that I do. Well, over the last 12 months, there's been numerous innovations that we've managed to implement, which have included a whole host at a practice level. Practices changing their working styles, working times, involvements of other staff to develop the team within care, and we're seeing some of the rewards of that at an early stage. Particularly practices, changing working times and doing visiting at various times to help prevent unnecessary emergency admissions. Obviously, it's been a great deal to win the award. But it's a pleasure purely to have been nominated. I'm well aware of the nominees in the category and the great work that they do. So purely to be there is a success in itself.